Good morning to all. In this last lecture of series of psychosexual disorders, we are going to discuss non-pharmacological management of psychosexual disorders. We will be covering in this lecture the sensate focus exercise, start and stop oblique squeeze technique, Kegel exercise, and psychoeducation. Let's begin with the sensate focus. So first we have to understand what is sensate. Sensate is relating to the ability to perceive, which is also called as notice or feel things through the senses, such as feelings, sight, etc. The skin is capable of detecting a range of sensate experiences such as heat and cold, and uh, basically the babies are sensate creature that acquires the ability to react to stimuli while they are still in the womb. So the sensate is not just regarding the sexual activity. The sensate is uh, present all throughout the lifespan, and it has a various roles in forming bonding, forming relationships, whether sexual relationship or out of the sexual activity. The Sensate focus was developed by Masters and Johnsons. It helps couples learn about themselves and each other because it's a bidirectional activity and to move towards more fulfilling intimate relationship. The aim of Sensate focus is to build trust and intimacy within the relationship, helping to give and receive the sensate. It emphasizes positive emotions, physical feelings, and responses while reducing any negative reactions. So, why and for what the sensate focus? The sensate focus works upon reducing the fear and anxiety during the activity, removes familiarity, and introduce novelty. If the relationship is old, there is a monotony which is removed by the sensate focus. It introduces relaxation and problems related to body image, arousal, desire, orgasm, premature ejaculation, and erectile functions are uh, being solved. About the sensate focus not a race to an end. There is no target, there is no goal. Its continuous reinforcement is needed to overcome negative reactions to intimacy. Typically, in sensate focus exercise, there are various sessions, and sessions might last 20 to 60 minutes for a once and 2 to 3 times a week, spread it over 6 or more weeks, depending upon the improving performance. It is important to go at your own pace. There is no hurry, there is no instruction to go by certain speed, so one can take their own pace to go from one phase to another phase. The ground rules for sensate focus are: one has to ask to choose a time and place acceptable for both where they wouldn't be disturbed. For the sensate exercise, ask to make the surroundings as pleasant as possible uh, by choosing music, lighting, and aromas which suits the both. Ask to turn off the phone, if necessary, lock the doors so there should not be any kind of distraction. Instruct to take turns giving and receiving touch. So this is a bidirectional relationship. Then the involvement of both the partners are important. So one by one, they should take turns to give and receive the touch and allowing equal time for each other. The goal is enjoyment and pleasure. Enjoy the journey rather than aiming towards an specific destination. So there is no goal, there is no target. Asked to take as long as they want over each phase. So there is no hurry. There is uh, one can take as long as they want to remain in the one phase before they are comfortable to go in the another phase. Only move from one stage to next when both partners are agreed. The general instructions for sensate focus. When it is one's turn to touch, take plenty of time to explore the partner's body. Experiment with different sensations and types of touch. Take pleasure in experiencing the texture, form, temperature of the partner's body. Ask them to try to discover the degrees of pressure and types of touch their partner finds most appealing. Ask them to give by encouraging feedback or by placing hand under their hand so they can show you what they want. When it is other partner's turn to be touched, make sure he/she let the partner know what you like and what you don't. One can tell their partner how you feel by various means of communication. Avoid saying don't, as it can be discouraging. It's more encouraging to say things like, it feels better when you do such and such. One might find it useful to talk about their experiences afterwards. For example, I really liked you when you done that activity. If there is something you would like to try, don't be afraid to suggest it. Now coming to the phases of the sensate focus. Sensate focus has three phases. First is non-genital phase, second is genital, then penetrative. We will get to know one by one. The aim of phase 1, which is non-genital sensate focus, is the first stage of sensate focus put the emphasis on sensuality, the simple enjoyment of physical touch rather than sexuality or pursuit to orgasm. So orgasm is not the goal in this phase. This phase focuses on touch and mutual exploration free from any concern that it will lead to sex. It's important, therefore, they abstain from any form of sexual activity during this stage. Even if one become very aroused, shouldn't touch one another's genitals or breasts, attempt to have intercourse or any other type of core sexual activity. Do not attempt to have or give an orgasm. Abstaining from sexual activity removes any pressure on the either partner to get an erection and become aroused or perform in any other way. It also helps break any established pattern of behavior that may have become routine and or boring. So this is an important part of sensate focus, that is non-genital sensate. The ground rules for non-genital sensate focus are: while it is preferably to be without clothes, one can wear inner wear or relaxed clothing if that feels more comfortable. Couple may find a book or video about massage will be useful if they want to learn different massage techniques. At this stage, avoid touching to the obvious erogenous zones. Only move from one state to next when you both feel they are ready. Sexual intercourse and orgasms are not permitted during this phase. The instructions for therapist can be: before the first session, decide who is going to go first, then take turn. During first session, concentrate on touching the parts of the body normally visible, for example, the hands, arms, feet, scalp and face. Include the back, neck, arms, buttock and legs also, but do not neglect the hands, feet and face. Finally, bring in the chest, stomach, shoulder and thighs, but avoid genitals, the breast, top of the legs and the groin area. Now come to the second phase of the sensate focus, which is genital phase. Now they can bring in touching of the breast and genital areas. Continue to pay attention to the parts of the body that were explored in the previous session as well as the new area that are incorporating. So one should incorporate the one should exercise the previous phase 1 exercise along with the phase 2, which is genital sensate focus. The main aim of these stages is to increase each person's pleasure and awareness of each other's responses to different type of stimulations. If one or both of they become aroused, this is fine, but it is not the aim of this exercise, the second phase. During genital stimulation, it is often useful to use a water-based lubricant. Sexual intercourse and penetration is not permitted during this phase also. The instructions can be: first, incorporate touching of breast and nipples. Remember, men have nipples too. Next, include the area around the genitals, then introduce touching of the genitals. After a while, one may also want to incorporate manual touching, like kissing. One may want to try the teasing technique, manually stimulate the other person's genitals, and take a rest for a few minutes and then begin again. If orgasm occurs as the stage or later stages, this is fine, but that is not the aim of this process. Now come to the third phase, which is penetrative sensate focus. Now they can begin to include penetration. Continue to pay attention to the other parts of body that one has explored in the previous sessions. The female should be in control of the depth and the amount of time spent on it. While orgasm and intercourse is permitted in this phase, this is not the goal. The aim remains to enjoy the growing intimacy between the couple. Initially, try this with little or no thrusting. Feel the sensation of containment. Try in different position. Later, they can incorporate more thrusting in this phase. So the conclusion is sensate focus is about to touch, uh, about to learn about the touch, and touch is most primal sensation and need. By the time we are young adults, touch is often paired with the sexuality and expectation about the sexual touch abound. But this touch sensate really present throughout the life of an individual since the childhood. People need to relearn the importance of touching for its own sake, which can be said as touching mindfully in sexual activity. Re-experiencing the sensation of touch without the pleasure to like it or to be aroused by it or to simultaneously arouse the partner helps create a connection to oneself and or to the partner. When the conscious mind gets out of the way of the body may respond on its own, building up a symmetric charge. Now come to the start and stop squeeze technique. The stop squeeze technique is one of several ways one can delay orgasm and prolong uh, masturbation or partnered sex. It may also benefit people with experiencing premature ejaculation. Now, how to use stop squeeze technique? The stop squeeze technique is a form of ejaculatory control. It allows you to near the point of climax and then back off suddenly by holding the tip of the penis and stopping the further stimulation until the sensation subsides for the orgasm or climax. One can repeat the stop squeeze several times to regain the timing and gaining the experiences in the orgasm. Other than start stop, one can prolong foreplay, which also helps in alleviating pressure and expectations by foregoing intercourse for a longer period. Instead, focus on other types of sexual play such as massage, intimate touching, and kissing. If you are trying to delay your orgasm but not your partners, you might also try manual stimulations. This way, you may be able to delay your climax until they are ready to. In other in the moment strategy, one can masturbate before the intercourse. One may be able to delay ejaculation during intercourse by masturbating an hour or two earlier. One may not be able to anticipate sex beforehand in the every case, but when you can, this strategy might be helpful. Now, Kegel exercise. Technique was developed by Arnold Kegel in 1940. It was initially used for pregnant women whose muscles around the hips becomes weak after parturition. But later it was tried for sex problems in the men, which proved somewhat effective. But the controversies are there. Kegel exercise helpful in male sex problems. The main purpose of this exercise is to strengthen the muscle around the hip, which are called pubococcygeus muscles. The benefit of Kegel exercise is it increases blood flow in the penis, which make the hard erection last longer, and it also beneficial in premature ejaculation. Due to increased blood flow to the penis, it increases the turgidity, it controls orgasm, ejaculation, and increases the duration of intercourse. The other benefits of this exercise are, after getting used to it, there is little need for urination at midnight, help in keeping the prostate gland healthy, help prevent rectal prolapse also. Now, how to do the exercise? This exercise is simple exercise. It can be done easily anywhere without others even noticing that you are doing it. But it takes dedication to master this exercise, and after practicing for few weeks, one can become proficient. So the question is how to identify pubic muscle. Contract your the pubic muscles are muscles which are around the pelvis, and it can be it can be recognized by the mechanism when you try to hold urination in between, then you have to contract these muscles. So one can find the pubic muscles by this exercise. So contract your pubic muscles in normal situation. Hold the Kegel contraction. After starting the contraction, hold it for as long as possible. Relieve the contraction and repeat. It may take time for some individuals to learn, but in 4 to 6 weeks you will feel the improvement. The special thing about Kegel exercise is that one can do this anywhere. Initially do up to 50 contractions a day and gradually incorporate it into your daily routine. During sexual activity, one can also exercise this. One can hold Kegel contraction for 10 seconds. Use it during sex to increase the time to ejaculation. During sex, when you feel that ejaculation is about to happen, immediately do the Kegel contractions and hold for 10 seconds. It takes effort, patience, and practice to learn it and adjust to it over time, but it is beneficial for the result, so keep practicing it. In the last, in non-pharmacological management, uh, one has to understand the normalcy. There are lots of misconceptions and myths regarding the sexual activity and performance in the usually in the younger population. So they feel anxious. So normalcy should be taught to them. The misconceptions and myths should be busted by explaining the reality. So their anxiety should go down, and if medications are required to lower down the anxiety, one can use the drugs also like propranolol and all. We also already had that lecture on pharmacology in the previous session, so one can go to that lecture and learn about it. So thank you. So we had learned about the Sensate focus exercise, the Kegel exercise, the other form of exercises like masturbating before sex, increasing the foreplay timings, and psychoeducating the younger one regarding the myths and misconceptions are helpful in managing the psychosexual disorders without medications. Thank you.